And we're now recording. First, how are you doing in all of this?
Well, hanging in the best we can. These are unprecedented times that we're living in. So, we're just making the best of it. Trying to help out. Look out for the community and look out for the family at the same time. So it's definitely been busy and definitely putting in the hours. That's for sure.
Yeah, so I think last I checked, it was 33 cases in the Hornell area, which is the majority of cases, I believe, in Steuben County. Is there a correlation you're seeing with these cases, or anything that you can speak to on that?
Well, yeah, I've been talking to health officials at the county level and also, local health professionals here at St. James, and we haven't quite put our finger on it. I know there's been a lot of cases in two of our nursing homes, and I think quite a few of the numbers that you're seeing, especially recently, have come out of the two nursing homes that we have here. And of course, those are the most vulnerable of our population. I know they're trying their hardest to, protect all those residents in the nursing homes as well as the employees themselves. We are doing everything that we can to try to promote social distancing, to get that message out to stay at home. Unless you absolutely need to get out for groceries or medicine or those sorts of things, please stay at home. And when you do go to the store, go by yourself. You don't need to bring your spouse. You don't need to bring your children. Just go by yourself. Take your list, get what you need, go home and hunker down. We still encourage people to, get out and, get some fresh air, go for a walk around the block, go for a walk around the park, but at the same time, practice social distancing as well. Proper hygiene goes along with that. Hand washing, wiping down surfaces, wiping down your steering wheel in your car, your doorknob, your railing, all those surfaces that you touch every day, that you don't normally even think about. So those are the things that we're trying to do.
Okay. With the nursing homes, I saw there were two more deaths in nursing homes in Hornell. Was that the same nursing home? And can you confirm which nursing home that was?
I just saw the report earlier, and I believe it was from Hornell Gardens, and that's on the southern end of the city. So I don't know the names of the people, but my heart goes out, and my condolences to the families and everyone that's been affected by this terrible virus. It's just so sad that the virus is preying on our nursing homes and the people that are just so vulnerable, and my heart just breaks for them.
Right. And have there's already a curfew in place for minors in the city of Hornell. Do you plan on extending that to adults as well, to try and limit social distancing, or to add social distancing, I should say, and try to help slow down that curve?
Yeah, we enacted the curfew a couple of weeks ago. The Board of Public Safety, we convened an emergency meeting to do that. The concern was with school not being in, and coupled that with the warmer weather that's here, we didn't want kids to think that they were on summer vacation and to go out and start congregating and and doing all the things that especially those of the high school age would normally do. So we took that step to enact the curfew. We are having a meeting later this week, the Board of Public Safety, that is, and we will be discussing, whether or not to take further measures and include all adults in that. So those conversations are ongoing. But again, it really comes down to individuals making good choices, staying at home, not putting other people at risk. Because when you go out, it's not just yourself that you have to worry about. You're endangering other people as well, and you may be carrying the virus and not even know it. You might not be symptomatic yet. So there's a lot of a lot of things that go into it. But we need to be conscientious of others and look out for one another during this.
Right. We had talked a little bit earlier about the through email about the DRI money. Now, right now, the state You can't use that money to help a restaurant that's closed, but the state has said they are looking into that. Is that something you would welcome, being able to use the DRI money potentially to help a small business, instead of updating the sidewalks, helping them, rehire staff or stay open for another week or two?
Yeah, absolutely. And we'll see where that conversation goes. That's up to the state officials, obviously. But I think that money could be applied very well to help people here locally. Obviously, we have sidewalks. Would it be nice to redo some of the sidewalks and some of the things downtown? Absolutely. But you know what? We have sidewalks, and we can replace those later down the road. You can't replace people, and all the businesses that have been closed are feeling a huge impact. I mean, this is their livelihoods, and it's not just the business owners; it's the employees that are out of work as well. And unemployment numbers have skyrocketed and spiked, and these are numbers that the country has never really seen before. This is unlike anything I can compare to in my lifetime. Certainly, I think you might have to go back to the Great Depression to find a comparable for something like this. But absolutely, if the state allows us to access that $10 million and use it for something other than what it was originally set aside for, then I would absolutely be welcome to that.
Where does the city stand in terms of the projects that money is set for? I mean, you guys had public meetings and there were projects discussed. Are all those projects on hold, or can you kind of work on those behind the scenes?
So, right when the pandemic was starting to break, we had just concluded our original or our final DRI meeting for the local planning committee, and we submitted our list of proposed projects to the state for review. And the state was supposed to review those and then decide which projects will be funded and make that announcement this summer. So, our work is pretty much done, and it's in the state's hands as far as what projects that they want to fund or think are worthy of funding and which aren't. So, we're just kind of in a wait and see mode for that.
Okay, can you say how many projects there are? What kind of projects you're looking at? Yeah, and if you can't go into specifics because the state has to approve, kind of a general idea of where you're looking to put that money towards?
Yeah, I mean, there was a whole host of projects. There were some public projects, which include the city projects, and that's the streetscape, the parking lot improvements, the alleyway improvements, and then there were the private projects, and that's the private business owners and property owners. Some of it had to do with facade work, some of it had to do with putting an additional story on existing buildings. There was a whole host of different projects out there. I believe that at one time we were up over 20, pushing 30 projects. We did pare it down to some degree, but we do have, I believe it was in the 13 to $15 million price range as far as how many projects were actually proposed. So they will have their work cut out for them. If they do, if the program stands the way that it was originally intended, we'll have more projects than we'll have funds available for, which is a good problem because that's the way you want it. But again, just to reiterate, if the state does allow us to access that DRI money and we can apply that to those affected by this pandemic, I think that would be very appropriate in this situation. And really, I think our focus, as elected officials, as community leaders, as state leaders, I think our focus should be on people, and these projects can be put on hold for some time.
Right. Is there anything else you'd like people in Hornell to know what they should be doing? Obviously, staying home, washing their hands, but anything else you'd like to say to the people of Hornell and people in Steuben County?
Yeah, I just want to say, take this seriously. This virus is not a joke. Lives are being lost. The people on the front lines at St. James Hospital, hospitals throughout the region, hospitals throughout the state, these are the people that are working on the front lines, and they themselves are at risk. And when they go home, their families are at risk. So this is a very serious situation. And I just, I'm just imploring people, just stay home, do the right thing, take responsibility, make good choices. You can still go out and enjoy the fresh air, go for a walk, but just practice social distancing. When you see neighbors or friends, just, you don't have to shake their hand. You don't have to be near them. You can wave from afar. You can still do those things, but we have to practice social distancing and proper hygiene to get through this.
And one last question. With the hospital, do you know if they, the status on ventilators and if they're going to be sending ventilators to the city?
At this time, I don't believe that they're sending any ventilators downstate. I think our hospital will be able to keep everything, and at least that's the latest information that I have.
All right, that's great. Mayor, thank you so much. Stay healthy, and hopefully this ends as soon as possible.
Yeah, well, I appreciate it, and thank you, and stay healthy, you and your family and all your coworkers.
All right, thank you. Have a good day.